All right, welcome everyone. This is the Dr. G Show educational series. We were going to do a bunch of live shows, but of course the coronavirus quarantine has changed all that for everyone. So we're living in a new world where we're going to do this recorded instead. So, which would be great. You can kind of share it with more people than you could come to the live events. So I guess that's good. Well, today we want to talk about reversing type 2 and type 3 diabetes. As you guys probably don't know, there is type 3 now. Type 2 is a fairly new thing, but type 3 is well, it's been out 10 years now. So in 2010, we actually got a type 3 diabetes. So not only have we changed this diagnosis 4 times for type 2, but now we've created type 3. Soon we'll create type 4. But what we want to do is talk about the simplicity of this, right? Simplicity is what reverses conditions. Complexity is what sells you things. So in my series, what I like to do is what's called functional lifestyle medicine, which is teach people how their physiology works and then teach them how we mess it up and then stop messing it up and everything returns back to normal. So as we go through this, feel free to post questions on this too. You'll see that our website is also nourishpurifyheal.com. And from there, if you guys don't know who I am, I'm Dr. Garrett. I have, I've been practicing for, I don't know, seems forever, 17 years, I guess. I have a DC, doctorate in chiropractic medicine. I also went to medical school for 3.5 years and quit 6 months from graduating so that I could practice this style practice. I was very frustrated in that system, and I didn't feel like we're helping people the way I wanted to help people. Now, life is so much more fulfilling, and I get to really help people the way I feel like they should be helped. So, also kind of specializing in hard-to-treat stuff, epigenetic kind of stuff, but, mostly chronic conditions. Teaching people how to reverse chronic conditions, kind of like type 2 diabetes and type 3. National speaker. I've spoke all around the country. I used to teach a postdoctoral graduate program where they can get through all our coursework and then sit for the boards. And then I've been a national speaker for a variety of topics to educate other physicians, and also an international speaker last summer at the International Symposium on Health and Wellness in Bangkok, Thailand. That was an amazing experience, and pretty much Thai medicine or Thai wellness is what I do now. So that was really great to see like-minded people, because in the U.S. it's always chronic management. Even in natural medicine, it's chronic management. Only at that international symposium where I was a keynote speaker did I meet people that were just teach people stop causing it. So that was wonderful. And that stimulus for that came from postdoctoral education, continuing education at lifestyle medicine program at Harvard Medical School. They offer this program for continuing education, focus on lifestyle medicine, which is teach people why they have their condition, teach people how physiology works, and then teach them to stop having that condition. So it was mind-blowingly awesome. And I don't even know if they offer that program anymore, but it was an incredible opportunity. And it changed everything about how I practice. Also, postdoctoral continuing education from Yale for lifestyle medicine. Also, biomedical engineering. They have an open course at Yale that I took with Dr. Saltzman. And that was an incredible opportunity. And then epigenetics through University of Melbourne. That was a wonderful coursework on epigenetic controls, looking at how genes work and how we can modify and change those. And then, of course, dermatology through Johns Hopkins, but lots of continuing education through Ivy League institutions where I want to know what the best of the best have to offer so that I can transition that somehow into patient protocols. So kind of like Bruce Lee took all the parts from all the different other martial arts to create his flow. That's what I want to do too, and that's what I've been doing, I guess, right? Lots of postdoctoral diplomates, certifications. I super nerd, so I love education, training. I want to know 10 different ways to fix everything. I have clinical clerkships that I did all throughout my life, quite a bit. think it's like 3,500 or more hours of clinical clerkship. So, and then leadership, membership. I remember a lot of things, but also am the director of a lot of things. Basically, if you do a lot of work, people want you to do a lot of work for them. So that's a pretty interesting opportunity. And then also I do research at KU Medical School. I'm one of the investigators, and we're doing some stuff on progenomics and for behavioral problems and anxiety, depression. It's really fascinating research. I think the coronavirus may affect us with that. And then I have a healthy cooking show, or used to, on Channel 43 for a couple years. But then also I have the Cooking After Dark with Dr. G show that's coming out at some point when we finish all the recordings. But otherwise, kind of living that lifestyle. So then it comes to this, right? So how do we really eat our way out of diabetes? Because people eat their way into diabetes. Can you eat your way out of diabetes? So the first question we have is, how did we create type 2 and 3? Is it reversible? What are the ADA, or the American Diabetic Association's false hopes and roadblocks that kind of interfere with what their kind of aim is versus what patients end up doing? That kind of sets them backwards. And then how can we live our way out of diabetes? I do realize that two of those are not questions, but I think that's funny. All right, so first thing with diabetes, is diabetes preventable, right? So is it 100% preventable? And we know that because we didn't have type 2 diabetes for most of the duration of human existence. So even the, when we look at, is diabetes reversible? So the American Diabetic Association has this kind of duplicity here, right? So on one side it says, hey, let's really kind of fundraise and find a cure for this. And then, but we'll say there is no cure. We got to keep fundraising. There is no cure. But then on their website, I even pulled down and used this as an example of patients that were type 2 diabetics that changed their lifestyle and reversed their diabetes. So the same organization that says you can't cure it also says, yeah, unless you do lifestyle stuff. So there is no medication that cures that, though. And even with diabetes being reversible, I mean, there was a time when I was teaching that people are like, you can't reverse it, you can't reverse it. And of course, we see that because nobody does lifestyle medicine. In this country, it's just, it'll take this medication that forces sugar into cells that don't want sugar and resensitize and basically just kind of force stuff to happen so labs look better, but it never fixes that problem. So when you look at the Greenspan, so this is what I taught, the 36-hour postgraduate certification course in endocrinology. There you go. Years ago. So Greenspan is what I used in medical school, but it's also was part of our Diplomate recommended books. And in there, it says diabetes is reversible. So I love that because in the book that all doctors learn from, it says it's reversible, but the clinical practice is not reversing. It's simply management. So when we look at this epidemic, now you'll hear me talk about epidemics all the time and how we cause these epidemics. You'll see where it's very low, we have a sudden epidemic, and we maintain that. So that's not how genetics works. So only 1% of disease is genetic. If people have stuff that runs in family, it's if you do what they do, you'll get what they got, right? And so that sudden epidemic of diabetes is no different than the other epidemics that we've created as Americans. In fact, diabetes affects 34 million, right? So that's 10% of the population. And diagnosed, that's 26, but undiagnosed, that's 7. And then we also have what's called prediabetes, right? So there's another 88 million prediabetics, which is basically there's 5 criteria. And if you meet 3 out of those 5, then you're prediabetic. And basically the prediction is that within 3 to 5 years, you'll be type 2 diabetic. So if you add that up, then the total risk for type 2 or type 3 diabetes now is 1 out of every 2 Americans in the United States, and at younger and younger ages now. So that's insane. I mean, that's a 19 I would say it's a post World War II creation that we've created, right? An epidemic that we've created. So it hasn't even been around that long, but we made it one out of every two. That's incredible. And so when it comes to like, investing in your health, the NIH, National Institute of Health, actually quantified finally how much it costs just to be overweight in America. And it turned out it was $4,800. So you pay extra, you buy extra, you're taking extra medications. Everything you do is extra burden for you. And that cost ends up being $4,800, which is crazy. $4,800. So that when you look at saying, well, what if I did a healthy program or lifestyle program or something like that? Holy crap, you're going to make money not being diabetic at that point. But if you then say, well, what about overweight? We said we know 80% of people that become overweight will be type 2 diabetic. Well, what does it cost to be type 2 diabetic? And it's like 12 grand. It's $1,000 extra a month just to maintain diabetes. And again, the programs out there are not to reverse diabetes. It is really to maintain diabetes, which then makes you maintain $12,000 a year extra expenses. So like we said, 80% of those overweight are now going to be type 2 diabetics. And I think America last year reached over 50% obesity rates for the first time in history. And I think we're 75% overweight in America. So it's crazy. So we basically guarantee this, When we look at that epidemic and, what it does is, holy crap, it's not just, nobody really dies of diabetes. Diabetes is on there as number 7, but you don't really die of diabetes. You die of all the complications of diabetes. So one of the reasons I really love what I do is because of my father. My father died of complications of type 2 diabetes in his 50s, right? I grew up, a little bit rough and poor, and my mom, she had to work 2 jobs or 3 jobs sometimes and go to school and try to raise us 3 kids, and we were very humble, if not just poor, but sometimes we were doing better, and then sometimes it was really rough. But at my dad's, oh my gosh, he had like cases of soda in his garage, like it was just like massive. All you couldn't even drink all of it. It was so much. And so in his refrigerator was just flush with food. So lots of fried banana and fried Spam back in the day, but lots of food there, right? Not healthy food, but food. And so the consequence of that lifestyle ended up having him with insulin insensitivity, and then excess sugar, excess insulin, and then that ravaged his nerves and his blood vessels, and he started losing his toes, and then lost a foot, and then below the leg or below the knee amputation, and then when they did the above the knee amputation, he had an embolism and died. So like at what point? Like even like I didn't get to talk to my dad during that point, but the idea of like at what point in your life as a big, strong, strapping man do you think like, oh, I lost a foot, like I'm cool with that? Like I'm not going to get my life back in order? Like this is insane? Like there is no positive outcome in the future with this, right? You're like, okay, what's next? Eyes, kidney, brain, what? None of it is worth it. And a lot of times people will say, especially guys, you'll hear them say, well, we're all going to die eventually. Dying's the easy part. Having to like wheel around in a wheelchair for the rest of your life, having somebody to wipe your butt because you had a stroke, dragging half your body around, spending like years rehabbing, like that is unacceptable. Unacceptable. And that first moment when you have some kind of blood sugar issue, that is that red light coming on your dashboard to say, am I going to be the legacy of those before me, right? So I don't want my children to ever watch their dad lose toes and fingers and legs and feet. That's insane. From a preventable, reversible disease, that's unacceptable because I don't want them to go through that. So my dad ate very, very different from how I eat. So my kids get to grow up watching me eat healthy food, right? And talk about food in healthy ways. So I don't eat just for pleasure. And again, I'm not perfect, but and my kids aren't perfect. But if you can do 80% good, 20% bad, or even 90-10, you're doing really hella good with that. Otherwise, you're looking at heart attacks because it destroys the arteries, cancer because blood sugar actually suppresses your immune system, which then allows cancer, and then the sugar feeds the cancer, stroke because it destroys the blood vessels, uh, influenza and pneumonia because, again, it suppresses the immune system, and then kidney problems, that nephra on there, on number 9, nephritis, nephrosis. Neph means kidney, just so you know. So it shuts down your kidneys. It destroys. I mean, your 18 million little filters that make up a little kidney, and it just destroys those. And then septicemia, because that's just infection in your blood, and that's because you lower your immune system. It takes one Jolly Rancher to suppress your immune system for 30 minutes. So 4 grams. The average kid's cereal has 12 grams of sugar in there, enough to suppress their immune system for 3 hours, and that's just off the cereal, not the candy bar, not the M&Ms, not the Skittles, and on and on and on. But a soda, which has 16 to 22 teaspoons of sugar in it, has enough to suppress your immune system for the whole day. And then if you get some overwhelming infection, then there's a consequence to that, and it sucks for you and your family. But it's preventable. It's something you have control over. And with diabetes, I mean, I think people get to where they're overwhelmed, like, well, what can I do? Because nobody has really good answers for them, right? But at our clinic, our job is to teach people to reverse their chronic diseases. And diabetes is that easy to fix, which when we talk about, we'll show some ADA cases, but we'll talk about a couple of our cases too. And we've had some insane ones where people reversed. And what's funny is, like, I remember the first few times when patients would be like, yeah, my primary said I'm no longer diabetic, but he wants me to put me on other medication just as prevention. It's like, God dang it, man. It's just like it's never ending here, right? So we can only do what we can do. So what do we have to look forward to, right? This is your legacy. This is what you have to look forward to as a kind of like a symbol for your children, right? Or the next generation. And so 11 million in 2000. In 5 more years, we should expect 20 million. And then by 2050, 29 million. You know what's messed up about that prediction? We already surpassed it. That was made before 2000. We already have surpassed that, right? That's crazy. We have about 150 million people that are already type 2 or pre-diabetic at this point. And at that 2000 level, it was just 165% increase. This is way off the charts now. So, and our goal with that is we're 1 out of 2, soon to be every single person. Now, some of you guys might ask, well, what's the difference type 1, right? What about type 1? Well, type 1 has been around and documented in medical literature for eons. I mean, 1552s, I think the first time they see it in an Egyptian medical textbook. And they used to call it Sweet's disease. So like the natives, if they peed on the anthill, and if they are peeing sugar for type 1 diabetes, then the ants are attracted to that. But if they pee on it, and pee is usually acidic, and it'll drive them away, then they're not. So they called it Sweet's disease. So my whole childhood, I was doing lab experiments on anthills. Turns out, not diabetic. They all scatter. So by 1959, that's when we see the first documented case of type 2. Like, it's not that long ago. So there might have been some like sketchy, kind of remnants of that before, some kind of how we are now, where we have ish cases, or NOSs, or there kind of looks like a duck, quacks like a duck, it's probably a duck. But 1959, it's considered type 2, adult onset, non-insulin dependent, right? So the very first textbooks that came out with this, so it didn't exist, then suddenly exists. Here's the diagnosis and how we figure this out. So you had to, it took 35 years or more to eat your way into this disease, and you didn't need insulin to maintain it. It was just dietary. Then we had to rewrite medical textbooks again because we came out with adult onset insulin dependent. Now it was so bad that just whatever our dietary recommendations weren't cutting it, right? And if you think about 1959, we were consuming about 140, 150 pounds of added sugar to our diets for the first time in history. And that's because we didn't really import sugar until the 1800s, somewhere around there. So that's insane. 1910, it was 10 pounds. So apparently your body cannot handle 150 pounds of added sugar to your diet. And then we created childhood onset insulin, non-insulin dependent diabetes type 2. This is amazing because this means, just like when we look at 1984, we created chronic fatigue, fibromyalgia for the first time and made them epidemics from the start. And then all other autoimmunes just skyrocketed with those. Like, that's amazing. Like, we're that good at screwing up the body at this point. So we got so good, it didn't take 35 years. We could do this now in childhood diets. And when you look at most kids' food, I mean, cereal sugar, the milk sugar, the toasted sugar, the jelly sugar, the juice is sugar. Well, if you eat sugar, 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 then what do you think is going to happen? There's a consequence to this, right? But again, we can control it. It just takes knowledge and effort. So then we created a new category, which we had to rewrite textbooks again, retrain doctors, because we created childhood onset insulin dependent. We created so much sugar intensity in their diet that even they couldn't bring it down. They had to have extra pig insulin to get it down. Then in 2010, we created brain diabetes, which is type 3. So it's Alzheimerism. So your brain runs off sugar or ketones, and most everybody, it's just sugar. And so that sugar goes into your cells and then triggers your cells and they work, right? But if you have so much excess sugar that your brain says, look, we're going to close some of these receptors off, downregulate those, now you become inhospitable to sugar. Suddenly your cells don't work and your brain slows down a lot. So then it seems like Alzheimer's or early onset dementia, chronic brain fog, that kind of stuff, right? So that's type 3. And I assume very, very quickly we'll come up with type 4 diabetes, which is the skinny type 2. So usually we have to see a lot of weight gain, right? So as the excess sugar comes in, we then create lots of triglycerides. We then store that as fat for potential energy that they'll never use. And then they end up with insulin sensitivity and insensitivity and then diabetes, right? But I think we can achieve this now before people become overweight. I mean, that's an incredible advancement of disease. So then people say, well, what happened, right? What did we do to cause an epidemic, a sudden epidemic? Not a genetic slow over generations, but what did we do to create a sudden epidemic, right? Well, the death rates from diabetes is up 300%. It went from the 26th leading cause of death to the 6th leading cause, but it also included 4 other leading causes of disease too. So in 2006, things radically changed, especially for everybody that's managing chronic conditions, but especially for type 2 diabetics. In 2006, the American diet became the leading cause of preventable death over smoking. It's now better for you to smoke cigarettes than to eat like an American. So that's wonderful, right? All right, so to recap that, type 2 diabetes is fairly recent. It's rising exponentially. It's self-induced and it's reversible. So, diabetes, this is a whole different thing here, right? Diabetes, just like most all diseases, are not actual diseases. Chronic diseases are rarely actual diseases. They are what are called allostasis reactions, right? It's an absolute predictable outcome to an abnormal lifestyle and diet. So when we look at something as simple as dehydration, right? So you have what's called homeostasis. Homeostasis is your body's ability to balance out internal and external environment. If you eat too much sugar, it'll store it as fat, and then you burn that off, and that's homeostasis, right? But if you went out in the desert, your body would get too hot, and you would respond by cooling off your body, so you don't die, by sweating. So that's homeostasis. Your body's balancing itself automatically. You don't have to figure this stuff out. It does it. But allostasis is when you don't give the body what it needs to maintain, and then it creates chronic dysfunction. So in this case, if you took someone out in the desert and you did not give them water, eventually they won't sweat. Their body will heat up. They'll end up getting uh, uh, was a heat stroke, a coma, and then they'll die, right? All right, so they got heat stroke. That's a disease. But really, the solution is drink water, right? If you drink water, you prevent and reverse dehydration. So allostasis is not disease. Allostasis is a predictable outcome to an abnormal diet and lifestyle. These are things that we cause, which a lot of doctors don't like to say that because they feel like it's victimizing. Oh, it's your fault. Yeah, it's your fault. It's our country's fault for the way that we eat. But these are things that we can control once we know something, right? So if they poison the water, is it your fault you keep drinking poisoned water? Yeah, but I didn't know it's poison, but now you do, right? Now, if I keep drinking it, then that's a problem. So we want to talk about this allostasis in a way of empowerment. You have the ability to change the legacy of your family. You have the power to change the legacy of your future. But it takes knowledge and change. Ignorance and complacency is the only thing that prevents us from being healthy and well and happy, right? So everything that's chronic is what we eat, drink, breathe, rub on our skin, and how we stress. All things that we have control over. So we created this society of type 2 diabetes. And so why? What changed? So what in the last 30 years created a national epidemic of something that never existed to making it 1 out of every 2 Americans, right? Well, we got bigger as stuff got bigger. So, dishes increased 22% since 1960, but in reality, I mean, we eat 75% too much food. We eat 75% too much food. And then we store it so we can go to a gym and pay a gym to walk on a treadmill, right? But we park as close as we can to the gym so we can walk on the treadmill. It's lunacy. It's absolutely lunacy. So, if we eat more, we're going to weigh more, but the stuff we eat makes a huge difference too. If you look at coffee, right? You take a normal cup of coffee back in the 50s and 60s, it's 40 calories. But you can go to Starbucks and you can get a coffee that's over 1,000 calories with just a cup. Just a cup. So that's a whole day's worth of calories for most people. In 1 cup, that means everything else becomes diabetes and obesity. If you look at sodas, same kind of thing. A soda, which used to be 8 ounces or 6 ounces, I think, and then 8 ounces, and then 12 ounces, and 16 ounces, and 22 ounces, and then so on, right? But it used to be like 97 calories. Now you can get almost a whole entire day's worth of calories if you get a refill, right? So you can get like 1,500 calories if you drink 2 big gulps, which people do. So that means that every entire other thing that you consume is obesity and diabetes. A really fascinating thing I figured out was in 1950, that little tiny burger that you would get in a Happy Meal, right, was an adult man's burger. You guys know that? Adult man's burger? That's crazy. So in 1950, a Happy Meal was an adult man's proportion of food. Little handful of fries, a handful of burger, and a handful of soda. That was an adult man's fast food meal, right? But we went from that 45 calorie burger to 1,600 calories or more. So I think the Carl's Jr., is that on here? I don't think it's on here. I think the Carl's Jr. new one's like 1,600, and they're all bragging about that. So that's, again, you're eating over one person's entire daily calories with just the burger. And then my favorite thing, which is, I loved going to Outback Steakhouse, getting a bloomin' onion, or an awesome blossom. It was called awesome blossom. And when I worked in restaurants, I used to actually make those. And, it's how do you take a 60 calorie super healthy onion and make it over 2,800 calories? 2 days worth of calories. 2 days. 2 days for an appetizer. The onion rings at that onion ring tower at Red Robin, I think it's 2,200 calories, right? 2 days worth of calories, which means everything outside of that appetizer for 2 days is diabetes and obesity. And then, so that should be pretty obvious, right? I mean, it's hard to think back to how we were before. But I'm in that generation, the cool generation, Generation X, that we saw a lot of that transition go on. But my parents saw all of it transition. There's a really good book called Eating History by Smith. That's about the 50 changes in dietary changes in American history, and it's pretty amazing that we used to come from this different place. We used to do these different things, and then everything radically changed. And now Marty Spence told me that she's at Songbird Juice Company. We have a podcast series coming up, but she said that over 50% of Americans now get 100% of their food prepared. So fast food, microwave, that kind of stuff. Over 50%. So it's, the only way we're going to change this is hands-on active changes here. So then the question becomes, what is type 2 diabetes, right? So before we can fix anything, we have to really understand the allopathic process of it, right? And what I love about type 2 is it is actually really easy. It's like thyroid problems. Super easy to understand, super easy to reverse, but it's explaining it in a way that makes sense. Because again, if you ask most people, they're going to tell you the most complicated, convoluted processes, usually because they're trying to sell you something to augment that process, as opposed to your cheapest, easiest solution to reverse type 2 diabetes is either come see someone like me or get a plane ticket and get the hell out of America, right? Because it's an American phenomenon. So let's talk about how we took homeostasis and created allostasis to create type 2 diabetes. All right. So imagine a room, right? Like at our place, we have all these offices and we have a hallway, right? So the hallway is your blood. All the offices are the cells. The goal of eating sugar from healthy sources is you then end up putting sugar in your cells, so then your cells can store sugar for future energy, right? And then, you have eating and starvation, and your body maintains very, very well, right? So imagine there's like 4 doors to my office, and those big blocks of sugar, right? That I don't know, I'm pretty sure you guys remember. I haven't bought one of those in 20 years now, but those I think they're a pound of sugar. They can't get in my office. They need a guy to bring them, or a woman to bring them, right? So they need a FedEx person. So FedEx is insulin, right? Sugar can't get in your cells without FedEx bringing the sugar to the door, ringing the bell, and then pushing it into the cell. So if sugar goes up, insulin goes up, and they're both highly inflammatory. So if I am eating a diet like most Americans, so 150 pounds of added sugar to my diet, and so FedEx is then having to hire more people. So insulin goes up, my sugar goes up. And then it's bringing sugar to my cells. I'm like, no problem. I'll stack sugar over here. I'll stack sugar over there. But eventually, I'm going to start running out of room in my cell. And I'm going to be like, you know what? I need to lock like one of these doors. When you lock one of the doors, you then downregulate a receptor. That's called insulin insensitivity. That's pre-diabetes. Because now more sugar ends up in the hallway, more FedEx guys are in the hallway waiting to put that sugar in. So They keep doing this. We're running out of more room. The diet hasn't changed. So eventually I'm like, dude, we got to lock another door, right? So we downregulate another receptor pathway. And then more blood sugar ends up in the hallway. More insulin ends up in the hallway as FedEx guys. And then we get a blood test. And the blood test shows you got a bunch of insulin and sugar in your blood waiting to be put in your cells. You have diabetes or prediabetes, right? Depending on what level we're at. So that's great. That's how you create the disease. You pack too much sugar into cells that don't want that much sugar, and then the body responds by downregulating the doorways or the receptors, right? So at that point, the normal physiology kind of lifestyle medicine practitioner would say, yeah, you got to stop putting so much sugar in here. Then you don't need as many insulin guys. And then you need to start burning off that sugar. So that way you create more room for sugar. And then they'll open more doors. And then you're non-diabetic at that point. Like, it is super, super, super easy to cause this. It's super, super easy to reverse this. You know, just that model of that. But what they do medication-wise, which we'll talk about some of these, is, you know, if you take metformin, but if you take even natural version like cinnamon or vanadium chromium, right? The whole goal is to say, look, FedEx can't get the sugar in. Why don't we take this extra guy? He'll go there and force the door open so you can cram more sugar in cells that don't want the damn sugar. So it makes the labs look better because it gets more sugar from the hallways into the doors. But the cells don't want them. It's still causing damage. It's still making the diabetes worse. And if they ever stop that medication, holy crap, it should get worse. Because that's not how you fix it. That's how you make labs look better. But our goal is not to make your lab look good. Our goal is to make you good, right? So to change that allostasis path to back to homeostasis. So then we end up, you know, outside of that, you know, understanding, we're all about, we're going to do some research. We're going to find this new technology, maybe new medication, maybe a new supplement. And we just got to like keep doing this research and find this. Oh my gosh, my Siri thinks I'm talking to her during this. So, so then you see these asinine things where the Juvenile Diabetic Research Foundation says if you buy some donuts, we'll donate some money to find the cure for type 2 diabetes or even type 1 with that. But you'll see that with, oh, I didn't put that one in here, but Kentucky Fried Chickens did a thing where if you buy a large soda, they will donate $1 to the Research Foundation. The whole goal is research, not fix, not cure, not prevent. It's just research for the sake of research, right? Like, how do we live with this disease as opposed to you don't eat donuts if you want any kind of like way of cutting this down in a society, right? So it's asinine. But I posted that on Facebook, and holy crap, people who love the Research Foundation ripped me a new one. You know, I told them that's just crazy, and so they just deleted people. So it's just like, I think we have two different focuses here, right? My job is to help people reverse the diabetes like that, and yours is to sell them a bunch of donuts and soda to raise money to figure out how I do what I do, which does not involve soda and donuts. All right. So there's lots of these roadblocks, a lot of false hopes, even in natural medicine, right? If you're with a practitioner, right, whether a natural doctor or a medical doctor, anything in between, if their goal is, look, we're going to put you on this for the rest of your life, that's not the direction you want to go. You want an ending. All these same people say, hey, your body's designed to heal itself, given the right opportunities. Great. Then if there was no supplement company or drug company, you can't reverse this? How the hell did they reverse it or prevent it before it ever existed, right? So the ADA is never really going to find a cure. They're going to find management for you, right? Now with diabetic drugs, again, they're forcing more sugar into cells that don't want the sugar, and then people are all excited because they have, you know, insurance to help them with this. But then you have people like, there's a family of 4 that They have to eat fast food every day off the dollar menu because he pays $1,200 a month on his diabetes medication, heart disease, like all the medications to deal with his diet from, uh, uh, it was Burger King. So then people feel like, well, I could buy a 2 liter of soda for $1. I can buy 2 pears for $1. Well, I'm getting more value getting the soda. But so, the way that we deal with this is really screwed up in America. Like, there's not a lot of people on your side that really wanted to reverse. Not that people are evil or the practitioners are evil or anything like that or have sinister kind of stuff. But again, if at Harvard they had a Crohn's course in lifestyle medicine, said, hey, patient has Crohn's, what are they doing to cause it? Teach them to stop causing it, it goes away. They have another course that says, here's Crohn's, what meds are we going to use? Medication, refer out for surgery, they poop in a bag, right? The different approaches, even from Harvard, for the same condition, one person ends up over-medicated and pooping in a bag and they've lost all their money. The other person just gets to live a normal life, right? Two totally different things, right? Most patients are chronically sick and dying prematurely based on what their current doctor doesn't know, right? And what they don't know or practice really is the lifestyle approach to this. So, that kind of like, well, what's in my toolbox to help? Well, here's meds. So then you have meds, that end up causing more problems because almost every single medication has known drug nutrient depletions, which is where you get a lot of your weird side effects from. So a lot of these medications that you are going to take for the rest of your life, they deplete things like B vitamin and magnesium and calcium, and then you have a whole side effect from that, right? And coenzyme Q10 and B12, again, those regulate mood, brain function, memory, detoxification, sleep. So you should expect that all those things are going to be problematic, right? You're gonna just chronically manage this. But again, when you look at things like CoQ10 and you look at B12, the recommendation is like, you just need to get out and start burning that sugar out of your cells, right? Well, great. Can I take some meds that will prevent me from doing that? I think that's a great idea. So people that take those for life end up with anemia, so they're tired and fatigued. They literally should cause fatigue. They should cause depression. They should mess up your sleep. They should mess up your thyroid. They should make it almost impossible to reverse this. Let alone, some of those medications end up killing people, right? So you'll see that most medications have a side effect of causing whatever you're trying to prevent, right? So Avandia, which this was 20 years ago, that was pulled from the market because it killed too many people, right? They found out that it caused congestive heart failure by over 50%. Again, the whole reason you're taking these meds with diabetes is so that way you can prevent heart attacks and strokes, and right? But then they find out, well, the med actually causes the heart attack and stroke, and by the way, you still have diabetes. And then bone fractures in the hands and feet, that's great. And then pulmonary hypertension. So, the thing that you're trying to take to manage the person, because they have a diet and lifestyle that guarantees that they're going to have this, then it's all counterproductive, right? You're causing more harm than benefit. The whole goal is, how do you help people without causing more harm or damage? So medications, we know, do not prevent or reverse diabetes. They simply make labs look better. They force sugar into cells that don't want sugar. But the minute you stop those, it's not cured. We know that drugs have harmful side effects. We know they have nutrient depletions. We know that supplements don't reverse diabetes either. Again, they will make blood sugar look better. But as long as you keep buying that supplement, usually from them, you can keep lowering your blood sugar and your labs look really good. But what if that company went out of business? Then what? Then it's going to just go crazy again, right? And insurance is not designed to reverse diabetes. Insurance is designed to maintain diabetes. It pays for drugs, chronic visits, chronic management. That's the frustration. It'd be way cheaper for them to just really funnel people to people that reverse it, So Why is type 2 and type 3 diabetes so easily reversed? Because we cause it, right? It's not a disease. It's a normal reaction from an abnormal lifestyle. We like to eat a lifestyle and live a lifestyle that's not consistent with life longevity, and we don't like the consequences. So then we just medicate those or even supplement those, right? So it's easy because we know why. So here's a couple examples that I pulled. So a couple of these I pulled directly from the ADA's website, right? Because what I love is they publish this. This is peer-reviewed, published research that they did, right? The site that says there is no cure says these people fix theirs, so, you know. All right, so this is Clinical Diabetes Journal, Volume 22, Number 1, 2004. And this patient here, they had a BMI, which is of 28. They're 46 years old, 206 pounds. Fasting glucose was 180. Now, we like to see that below 110, 100, 90, really 70s, 80s is kind of functional range, right? Different labs use different ranges. And then total cholesterol, 200, which that's not real, but again, we don't care. That's another program on the Dr. G the YouTube channel. We talked about cholesterol myth killing you. So anyways, cholesterol LDLs, now they lowered this number, but 142 used to be okay. But now I think that's high. I think they dropped it to 90. But again, depending whether it's LDL-A or LDL-B, makes a huge difference. But look at the diet. That's the main thing here, right? This person's diet is cereal. Cereal is just sugar. I literally, like, I don't know what I'm going to do with Siri. She keeps, every time I say cereal, she keeps turning on, so... I think she's hungry. So, all right. So cereal is just sugar, right? And then they add sugar to the cereal. Milk is just sugar. Apple, perfectly fine. Now, fruit does not cause diabetes. Fruit does not cause obesity. Fruit reverses it. So even though when they talk about, oh, it's sweet, it's low glycemic, we'll talk about that a little bit later. All the bullcrap that they tell you about food is almost the opposite. Turkey sandwich, the 2 slices of bread are sugar. And then it's glued together with tissue transglutaminase for the turkey. But apple, again, that's good. Mexican food, probably wheat, dairy, kind of inflammatory stuff. And the cookies are just sugar, and then more milk, which is sugar, right? So this person's eating sugar, sugar, fruit, sugar, fruit, crap, inflammatory crap, sugar, and more sugar. So they should have type 2 diabetes, which they do, right? They should have obesity, which they do. So, let me see. Okay, so the second, so what he did was 2 months later. So this is 2 months. People suffer from type 2 diabetes for years, right? Risk of losing everything and dying prematurely. 2 months. BMI is 25, which is better. Still 46 years old. A 7% decrease in weight. And this is what I love. Is like, we don't do weight loss here. Everybody loses weight. And some people lose a dramatic amount of weight. But it's because you normalize the body. Normalize the diet. But look at fasting glucose. Down to 97, which is technically perfect. And again, it's only 2 months, but you'd like to see that a little bit lower. I don't know what his A1C was. LDL cholesterol is 93, total cholesterol is 146. That's actually kind of sketchy, but again, we'll deal with that later. Now, look at his dietary change. Good. Input. What's his input? Fish, low glycemic. Salmon, low glycemic. Steamed rice. Now, if it's white rice, it's kind of sugar, but if it's brown rice, then it's not. Black rice, red rice, purple rice, forbidden rice, then it's actually reversing it even faster. So he could do a little bit better. Vegetables, not sugar. Flax, not sugar. Wheat germs, inflammatory, but again, not sugar. Pecans, cinnamon. But then we have milk and cereal, so that's sugar and sugar. Turkey sandwich, sugar. And then some milk and some granola, and granola probably has sugar in there, right? So this guy just really added a bunch of extra healthy stuff. And then he did 40 minutes, 6 times a week of some cardio. So anything that makes you breathe harder, actually burns sugar 18 times faster than lifting weights, right? Anything that makes you breathe harder burns energy 18 times faster than lifting weights and 36 times faster than doing a big fat nothing. So this guy moved more, and again, 40 minutes, that's not bad. And you can even break that up, four times a day, 10 minutes. And again, it doesn't even need that for most of my patients. But little changes. Reverses diabetes, right? Then we have this patient. Oh, this is, I think this is mine. Yeah, I'm look at that. Yeah, so this is one of my favorite patients, right? So this patient came from Oklahoma up to see me. Her sister's worried because she's going to die. She's like, I mean, nobody can help her at all. She's 45, 185 pounds. So again, not too bad there. But she was on maximum insulin. They could not even give her more insulin because we don't even have the possibility in the formulary for that, right? But her fasting glucose was 500. Her A1C was unreadable for 5 years in a row. And I have never, ever, ever, ever seen an unreadable A1C. We don't know how high it was, right? But her diet was pretty typical. Lots of grains, lots of dairy, lots of processed meat, lots of crappy food, right? So, and she really didn't do much of anything. So she managed an apartment complex, didn't really move a whole lot. So, how fast can you reverse the physiology who's maxed out on insulin, fasting glucose of 500, A1C unreadable for 5 years? And this is what I love about what I do. Because again, you're talking years of patients suffering with this stuff. The fact that she's not already dead was amazing, right? So, 7 days. It took 7 days. 7 days, right? So after day 7, her blood glucose fasting was 88, which is, again, 80s is kind of where you want it to be. She was on half the insulin just in 1 week. Half the insulin. Now, this is the problem with my kind of practice is you don't, like, someone's been managing this patient for 20 years and then 14 weeks you're like, okay, bye. Like, prefer more people. But look at the dietary changes. So she did really well. Like, she was really concerned. And what she did was eat lots of fish, vegetables, fruits, vegetables, nuts, seeds, berry, legumes, greens. She added more water. She changed from dairy milk to almond milk. And then she added mild exercise, okay? So, like the last case, he did really active stuff. She started just walking, like, again, she doesn't do much. So she started walking the whole apartment complex, and then she got stronger and stronger and could do more and more. The other thing is stress reduction. Now, the guy on the last one didn't do that, right? But your liver makes makes sugar from scratch called gluconeogenesis. So one of the ways that humans are designed genetically to respond to stress is by making more blood sugar so they can run or fight or do both, right? So if you do punches, then bail, right? Y'all know what I'm talking about. So you can eat a candy bar or you can stress a candy bar. And that's, again, where a lot of other doctors fail in their approach, because if you don't deal with their ability to make their own blood sugar, it's going to suck. And if you don't make really lifestyle changes and teach them how to find their own happiness, they're just going to revert back to the old ways. So that's why it's what you eat, drink, breathe, rub on your skin, and how you stress. That's how you reverse almost all chronic disease. It's all the stuff that you're doing, which can change. So this patient, her real name's not Martha, but this patient, her sister actually wrote me a card and said, you saved her life, But that's crazy. And this is why, again, she's my dad. These people are the same people that, they're going to lose. They're going to lose their parents prematurely. It's not okay. This one was interesting. This was a big weightlifter. He's 22, 180 pounds, but again, not 180 fat. He was just ripped, right? So he was super bulky. And he was actually on maximum insulin, and to the point where, like the other woman, they were buying it off Craigslist. they were buying extra insulin from other people because nobody would prescribe them enough insulin. And his fasting blood sugars was 450, which is much like hers. We don't have an A1C for him, but his diet was the same exact crappy American diet, right? That causes this. And with him, by week 10, so this is 2.5 months with him. Which again, he's a guy, which they usually don't do what they're supposed to do, but this was really amazing. So after 2.5 months, fasting blood sugars at 85, no insulin. So he was maxed out and buying extra insulin, and now nothing, right? And again, his diet was fruits, vegetables, nuts, seeds, berries, legumes, and greens. Lots of extra water, lots of fish, and mild exercise. Again, his was mostly, I think, weightlifting. And then stress reduction, right? Changing the mindfulness approach for him. But that's crazy, right? And especially at 22, he was going to have years of losing limbs from this. So, that being said, the goal really is to create homeostasis again. Understand what causes it. Stop doing that. But you have to have someone to help you with that. Everybody has their hero's journey, right? And most people's initial response to a journey is refusing, right? Oh, it's hard. It's difficult. I get lots of confusing information. I mean, I read this book and that book, and I yo-yo back and forth. And every time I do some weight thing, I'll lose weight, and then I gain more weight 6 months later. It's ridiculous, right? And you know, Tufts University published a study years ago, and they said that there was 3 truths to all weight loss programs since 1950. So about 60 years of research found basically 3 truths. And, you know, we've only been doing weight loss since about 1950s because we didn't have weight gain really nationally until 1950. So that's where you see those weird we'll jiggle the fat off, and we have rollers going up and down. Maybe we'll roll the fat off, and we still have just asinine ideas of how to fix things even today. But that's because, you know, we just didn't know what the hell we were doing at all. In the documentary Fat, oh my gosh, the very end, he's like, even people that get gastric bypasses, the Harvard professor said 97% of all of them fail to get people to their ideal weight. So basically, it said no weight loss programs work and bariatric surgery does not work. You're super screwed. It's too complex. We'll never figure it out. You know, unless you lived in any other country in the world, right? So, or before 1950 or 1910. So the 3 truths that Tufts University came out and said for all weight loss programs. So Jenny Craig, Atkins, the cookie diet, whatever you want to pick, right? The number 1 outcome was most people will not do it. So it's too hard, right? They're not going to do it. The second outcome is the majority of people that do a weight loss program and stick to it will never lose any weight. The majority will never lose weight because you can cut down calories, but if you don't address making sugar in your liver from stress, then it ain't going to change. And then your diabetes doesn't change. Your risk doesn't change. Your weight doesn't change. But here's the critical one. The third outcome is that the majority of people that stick to a program, no matter what it was, on average will lose 40 pounds. So they can do paleo, keto, Atkins, super Atkins, keto, paleo, mega 3000. It doesn't matter. The average weight loss, no matter what, if they stuck to it, was 40 pounds. But the majority of them would gain that weight back plus 60% more within 6 months of quitting the diet because they never changed their lifestyle. We're just Americans trying to have some quick fix scheme, and that's not how any of this works. So we want sustainable lifestyle changes. We want a lifestyle that's just consistent with life and longevity without gimmicks and nonsense. And that's what we do in our clinic every single day with patients from all around the world. People get their life back. But it's not gimmick. It's not, you know, management. It's here's how your body works. Here's what we do to mess it up. Stop messing it up. So lifestyle goals, basically, we want to control and then reverse the type 2 diabetes. We want to manage the blood sugars and lose weight safely and effectively and sustainably. And of course, stop neuropathies and reverse neuropathies when we can. Manage hunger safely, and that's a whole different process here. And then actually teach people how to make food, what is food. So that over 50% that never actually make their own food, here's how you make food. Here's how you buy food. Here's how you pick out food, right? And then increasing movement. We call it exercise, but you got to burn off that extra sugar in the cells. So, basically it's really a two-pronged process. Is one, stop causing it. So change your intake, change your stress. Those are the things that raise blood sugar. But then you have to burn off that sugar. So increasing movement. So the average American walks 1/4 of what the rest of the world walks on a daily basis. So just that, right? Just that by itself. So these are a few ideas. Now this isn't exactly what we always do in clinical practice here, but these are our kind of success ideas for you. So you want to eat appetite suppressing foods, which is pretty much fruits, vegetables, nuts, seeds, berries, legumes, and greens. If you don't know this, kombucha or fermented foods, they're really good because they actually bind to sugars that are in your food, just like fiber does. So fiber binds to sugar. 80% of the sugar that's in fruits and vegetables and all that, fiber binds to that, and then that goes to feed your gut bacteria as prebiotics, and then that makes a lot of good B vitamins, and you're healthier and happier, more energetic. And then it also makes butyrate, which is something your DNA polymerase eats to edit out mutations in your DNA. So this is awesome, right? So this diet is all about reversing diabetes, but also the damage that's been going on with it. Now, there are supplements that kind of help short term, but don't do cinnamon. Cinnamon, there's GPL1, and it actually increases it, and it also interferes with it. So most of the traditional things that we learn in natural medicine of like to augment blood sugar, it actually also regulates it or upregulates it as much as it downregulates it. So again, we don't really see people like, oh, I'm going to eat some cinnamon and it's all going to be better. You can't do that. But dopa mucuna, which is mucuna parens, that actually suppresses your appetite because it has a high amount of L-dopa, and that crosses your blood-brain barrier and becomes dopamine, and the dopamine makes you feel doped or kind of satiated. So you got 66 hormones that regulate hunger and satiety, right? Satiation. I don't know. But anyways, 44 of those regulate hunger. So you gotta feel satiated so you're not hungry, and then you don't crave. And that's a really wonderful process. Now, we don't do that with patients anymore because we changed their whole lifestyle, their whole kind of brain outlook, neuroplasticity, resiliency, and then they don't really need it. So we don't augment that anymore, but we used to, and you can. And then restoring low glycemic. So again, we went low glycemic, low calorie, but nutrient dense. So eating the rainbow, right? Eat fruits, vegetables, nuts, seeds, berries, legumes, greens. Now on here I say whole grains, not just wheat. But don't eat wheat. Have it on there because that's the recommendation, but don't eat it. Don't eat it. It's inflammatory. It's causing most of your problems. Actually eat it, and then come see me if you have problems, and then you can pay me to tell you to not eat it. The other thing is, when we look at high glycemia, so we've talked about, the average breakfast for Americans is sugar. And so if you look at this chart over here, right, if we say, hey, this is the flattening the curve, just so you know, for the coronavirus, it's the same thing for your blood sugar. So I think they stole that chart. But if you look at this, the average blood sugar is about 80, 85, something like that, right? When we eat too much sugar, it spikes up too high, and we overproduce insulin, we drop it down, and it should have like a normal balance like this, right? Not a bam, bam, bam one, right? So what happens is if you eat cereal, which is sugar, and milk is sugar, and the toast is sugar, and the jelly is sugar, and the juice is sugar, basically sugar without fiber rapidly absorbs, and then your blood sugar goes way too high. So we overproduce insulin and we drop it too low. So now our brain needs sugar to function. Our body needs sugar to function. We feel shaky, brain foggy, and then the body has to get blood sugar up without more sugar, so it uses epinephrine, norepinephrine, so it can make your liver make more sugar, right? But that also means that you're causing anxiety. You're causing stress. You're causing hormonal exhaustion with that. Every single meal with that. It also raises growth hormone, which then causes cancer. So, you know, es no bueno. So that's why we want to do low glycemic. And when you look at this chart, this is kind of is a nice little final summary, basically, of what the hell we're doing wrong here, right? So in America, we'll blame food. We'll be like, oh my God, potatoes are making us fat. Really? Because the countries potatoes came from, South America, they're not obese, right? So then we say, well, we take a bunch of synthetic estrogens and then we blame soy. It's got to be soy that causes all the problems. Well, flaxseed has more phytoestrogens than soy does. And so the same people that tell you to stay away from soy will tell you to eat flaxseed, which makes no sense whatsoever. But also, the soy is a phytoestrogen, which is like estrol and estrone, not estradiol, which is the synthetic. So we drink dairy, which is estradiol. We take synthetics, which is estradiol. And then we end up with heart disease and cancers, and we blame food, which is ridiculous, right? Or the really fascinating one, which was like funny to me because I've been to Japan and Okinawa, and they said carbs are going to make us fat. Carbs is all the problem, right? It's always carbs. Really? So don't eat rice because then you'll be fat like Japanese people. Oh, don't eat pasta because you'll be fat like the Italians. Not Guido Italian, but like real Italians, right? So it doesn't pan out when you look at other countries, right? Either those foods are not problems or God just hates Americans and uses those foods to harm us. Ridiculousness, right? But if you look at how fast things become sugar, that's called the glycemic load, or glycemic index. So if you look at this, you'll see fruit, 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 fruit. So fruit is low glycemic, fruit reverses diabetes, fruit reverses cancer, right? Even on this side, I mean, you will see like watermelon and honey, right? That's high glycemic. But no one in the history of anything has ever gotten fat off dates or fat off honey or watermelon. That's the utter ridiculousness, right? If you look at the other things like, oh, bagels and corn chips and mashed potatoes and Cheerios and those rice puffs and French fries and, yeah, white rice, instant rice. Yeah, that's how you make people obese. That's the American lifestyle, the American diet, which is just overwhelmingly just a bunch of sugar, right? But even if you look at like brown rice, long grain brown rice, so lots of fiber with that rice, that means it cooks slower. It's a little bit chewier, right? We don't like that. So we'll do white rice, which is more sugar. And then we do instant white rice, which is pure sugar. So it's not the food, it's what we do to basically make it more convenient. So yeah, I have to take a little less time cooking food, but now I have diabetes, and then I have $1,200 of medication, and I lost my toes, and I have to roll in a wheelchair around so that I can eat quicker food. That's some straight up craziness, right? But we don't think about it in that context. It is not the food that's the problem. It's what we do to the food that becomes the problem. It's the convenience. It's the instant. And then when you look at these categories, yeah, I should be eating mostly this, fruit, vegetable, nut, seed, berry, legumes, and greens, and a hell of a lot less of that, right? So I hope that makes sense. The other thing is really teaching people what food is, how to cook. There's a handful of recipes that you want. I call my staples. But if you follow me on Facebook, you'll see that I make lots of delicious food, but it wasn't always that way. It was an active choice. I don't want my kids to grow up like my dad. I don't want my kids to see me like my dad. I want my kids to see their dad as healthy, happy, and balanced. And that's an active choice to participate with doing a little bit of cooking. Now, I do mostly raw vegan, so I don't do a lot of cooking anyways, and we do more grazing, which is way easier, way easier. The other thing is lower calorie intake, so the 80% rule is just eat to get rid of hunger. Do not eat to be full. There's 45 more minutes of extra eating, which then makes us eat 75% more food. So really, your plate should be the size of your hand. And once you feel not hungry, you're done. But once you feel full, well, now you have to exercise all that extra energy off. Now you're more likely to be overweight and diabetic. So eat a hell of a lot less food, but eat a hell of a lot better food with that. So, and then of course exercise. Like we said, cardio is energy at 36 times faster than couch potato, 16 times, or actually, see, math, it's actually 18 times better than, that's not true at all. So I used to teach physiology, and one time they messed up our anatomy and physiology textbook with this. So I can't say too much here, I guess. But doing nothing burns 1 unit of energy. Doing weights is twice as much energy. But doing cardio is 18 times more energy. Just so you know, right? So anything that makes you breathe harder, you are now invoking aerobic respiration with that, and that burns energy 18 times faster than lifting weights and 36 times faster than doing nothing. So that, again, might be carrying groceries, it might be chopping stuff, mixing stuff by hand, walking further. It's those little things. The healthiest, happiest, longest living populations aren't doing cardio stuff like, PX90 and nonsense. They just have an active lifestyle. That's really what you want. When I was in France, in Paris, the beautiful, beautiful, beautiful parks. All these old guys that look like they're in their 80s are out there playing bocce ball, and so they're having all this social time together. They're getting sunlight, fresh air, and they're getting some activity, right? So it's wonderful. That's what you want, just a lifestyle like that. So a good book maybe to start with is Blue Zone, by Dan Buttner. That's a great way to say, well, what are the world's healthiest, happiest, longest living populations consistently do, right? Without gimmicks and nonsense. Now, one thing you might do too is, if you're concerned about any of these, really looking at fibrinogen, A1C, fructosamine for short-term stuff, C-reactive protein, homocysteine, actually C-reactive protein, and maybe doing glucose challenge and HDLs. Those are your really good indicators for lifestyle, right? The inflammatory stuff that's going on, but it's all stuff that is diet and lifestyle related. So even if these were out of range, which is good warning lights, but then how do we restore them? It's back to lifestyle and diet. So we help patients with that all the time. And then, decreasing inflammation. So if it's fibrinogen's elevated, it's food. If C-reactive protein, it's food. If it's homocysteine, it's probiotics, and those are fed by food. HDLs are great because it's physical movement and healthy fats, so it's pure lifestyle. HDLs are great indicators of how well you're doing, So, reversing diabetes in short as 2 months is basically, this is a totally different than what we do clinically, right? But this is what we do based on I'm pulling this from the research and stuff that we see. So a little bit different what we do to reverse it in the office. In short, it's 14 weeks, but this is kind of general aggressive recommendation. So decreasing calories, again, not all that much. Maybe intermittent fasting would work perfect for that. Aerobic respiration, which means getting your heart rate up, and you don't have to measure that. You just know that you're breathing harder. Appetite suppressing food, or even like meconioprinins for some people. Antioxidant, which is eating the rainbow. Optimizing thyroid and hormones, which again is mindfulness, de-stressing, neuroplasticity, kind of rewiring your brain for happiness and less stress, because life is not what happens to you, it is how you process it. And then, of course, food is medicine, or what we call food therapy, but really it's just food is medicine. And then, of course, you say, well, gosh, that's a lot of work changing my lifestyle, right? This is the way I was raised. This is how my mom eats, my daddy eats. Is it really worth it? Yeah. Growing up with a dad would be great. Growing up with a mom would be great. Not losing your feet and your toes and your heart and your eyes to diabetes, that would be kind of wonderful, right? And especially, it's hella cheaper to not have diabetes, to reverse all that. And then one thing I really like is there's a documentary called the 650-pound Virgin. And, you know, and there's another thing called Never Ever Give Up that you can look on YouTube. And I love those things because, you know, there's certain points where we get where we just feel like, what's the point? How would we ever, ever become a different person? But like this dude, 650 pounds, ended up, I think it was like 2.5 years, got down to like 220 pounds or something like that. Like he lost 400 pounds. And he, in the beginning, he could only lift like cans of soup. Like it was nothing. But he could do that. And so he did. And then he did more. And then he did more and more and more and more and more. And the kind of like more activity he got, the better he was feeling, the more he started doing more changes, right? But he had good a couple of mentors helping him. The Never Ever Give Up one, that's a great video on YouTube because same thing, this guy was told he'd never walk again unassisted, and, you know, he's just overweight now from paratrooping, being a paratrooper and jacking his legs and his back up, and then he started doing yoga, eating healthier, and all of a sudden he could run again. Like, he got his whole entire freaking life back, right? He got to be a totally different person for his child to look at, and, you know, in his relationship. But personally, he was no longer a martyr of his lifestyle. He got to be the person he wants to be. And, you know, it might be like, well, what's the point at 50? Yeah. You want to have a stroke at 50? You want to have a partial heart attack? Like, that sucks. So getting your life back's amazing, and it's always, always worth it. If not for you, for everybody that's watching you. So I really appreciate you guys. There's the old picture on there. Thank you guys for listening. Certainly look at all the other stuff that we have on our YouTube channel. There's 169 Dr. G shows. Most of them are on Facebook video on my channel there, but we're trying to get those transferred over to YouTube. So, and I think you can watch this on TV too, on the YouTube channel if you have a smart TV. So, anyways, I really appreciate you guys being a part of this. I hope like something in you stirs if you need this, or someone else that needs this. Is, you know, what an amazing thing would be to have my dad still alive just by changing his lifestyle, right? Or, you know, how much he suffered with losing toes and feet and stuff. It's unacceptable. It should be unacceptable, especially now that we have children with diabetes. That's unacceptable. So I appreciate you guys listening, and look forward to more talks. Bye, y'all. Oh, and our website is Nourish, Purify, Heal, and we do have, especially since Corona, we do have opportunities for new patients, obviously, and we specialize in reversing type 2 and type 3 diabetes for you. So give us a call if you need the help, and you can find us on the website.